Hey everyone. So on this slide, we're going to talk about the primary musculature of the diaphragm. We're going to talk about its shape, its connections, its innervations, and we're also going to get into its respiratory function for inhalation and exhalation. So the shape itself, it's a dome-shaped muscle. In the picture you can see on the right side, the right dome is a different shape compared to the left, and its attachment on the lumbar spine on the right side, the right crust is lower than the left. There's a reason for that. So on the right side of the body, we have more organ displacement on the right side than we do on the left. The right lung has 3 lobes compared to the left, which only has 2. We also have the liver underneath the diaphragm on the right side, and we can also see that the right kidney also sits lower on the right than on the left. Now, the diaphragm takes up the shape and displacement for the positioning of the organs and also what is present there. The costal attachments on the inner surface of the lower 6 ribs, so it's going to come down specifically on ribs 7 through 12. The lumbar attachment, like I mentioned before, on the left side it's actually going to come from L1 to about L2, L3, and on the right side it's going to be from L1 to about L3, L4. It's also going to have a sternal attachment on the inner part of the xiphoid process. The central tendon of the diaphragm is actually going to come up, and it's going to have attachment sites and fascial connections to the pericardium and to the lungs. We're also going to have the inferior vena cava, the descending aorta, and the esophagus come through the diaphragm itself. So there's going to be actual holes in the diaphragm that allow those to pass through. Innervations of the diaphragm, specifically the phrenic nerve, bilaterally from nerve roots C3, C4, and C5 that will allow it to facilitate inspiration and expiration. So when the diaphragm, when it functions for respiration, for inhalation, it's actually going to move inferiorly. It's going to develop negative pressure to allow air to come inside. Now, when it does that, we also have to remember that there are organs there that need to be displaced. So the abdominal muscles in the pelvic floor are actually going to be less active in inhalation than in exhalation to allow displacement of those visceral organs. We also have to remember that when it comes down and contracts, that it's actually going to pull the lumbar spine anteriorly as well, and it's going to externally rotate the ribs to allow more space for air to come in. Now, the opposite is going to happen for exhalation. The abdominal muscles in the pelvic floor are going to be more facilitated to allow that pushing out of the air, and the ribs are going to move internally rotate, and then the lumbar spine is going to relax and not be pulled so anteriorly. It's going to come back more posteriorly. So that is a brief overview of the diaphragm, its anatomy, and also its respiratory function.